Hello there, I'm Black Bright News, and I was just looking in the at AOL today, and it's as we suspected. They're talking about a virus. So let me just read this. Let me just put on my glasses. And this is the news item. And the headline is What We Know About Chikungunya Virus as Cases Spread in China. Isn't that where the virus spread last time when we had the pandemic? This is written by Emma Clark. The date is August the 6th, which was yesterday. More than 7,000 cases of chikungunya have been reported in China's Guangdong province since July. Authorities in the region have since enforced restrictions not too dissimilar to those taken during the COVID-19 pandemic. For example, infected patients are being quarantined and can only be discharged once they test negative. More drastic measures taken include masked soldiers spraying insecticides on plants, parks and in streets, and the introduction of more than 5,000 larvae-eating fish. Also in the city of Foshan, not only have authorities brought in a mandatory name registration for medication, they have implemented fines and penalties for those who ignore the rules. Outbreaks of the virus, which is spread to people by infected mosquitoes, have previously occurred in Asia, Africa, the Americas, and Europe, as well as islands in the Pacific and Indian Oceans. So, I have heard about mosquitoes in England. I don't know how they got here. We don't know if they're infected or we're going to be told they're infected. I'm not quite sure, but just giving you the heads up. Authorities in Jordan. What is chikungunya and how is it spread? Chikungunya is a virus transmitted by female mosquitoes, mostly commonly the Aedes aegypti and Aedes albopictus species. It is passed to humans through bites, primarily during daylight hours, and to other mosquitoes, if they then bite an infected human. The best way to prevent mosquito bites is to wear clothing that minimises skin exposure, in other words, cover yourself up, and shut windows, doors and screens to stop them from entering the home, and use repellents containing DEET, IR3535 or icaridin. Insecticide treatment mosquito nets can also be used to prevent these day-biting mosquitoes from infecting day sleepers. Authorities as those in China are currently doing insecticides to kill mosquitoes. Now, to the interesting part. Chikungunya in the UK, according to Professor Will Irving, Emeritus Professor of Virology at University of Nottingham, there is no risk of contracting chikungunya in the UK at present. Speaking to Science Media Centre, he added the mosquitoes that transmit chikungunya are not established in the UK, although they are found in parts of southern Europe. Occasionally, imported cases are diagnosed in returning travellers, but these do not lead to local transmission. The government website updated its chikungunya page in June, stating that there have been a small number of cases reported in England, Wales, Northern Ireland each year. How come it's been reported each year if it only came out in June in China? Interesting. Most have been acquired in South Asia and Southeast Asia, the article reads. Hilary Kirkbride, Head of Travel Health at UK HSA, told Yahoo UK there is continued transmission of chikungunya globally, and we continue to see infections in travellers returning to the UK. The unpleasant mosquito-borne disease is rarely fatal, but can cause severe joint and muscle pain and headaches, sensitivity to light, and skin rashes. Thankfully, symptoms usually improve within 1 or 2 weeks, though joint pain may last for months, even longer. It is essential to take precautions against mosquito-borne infections such as chikungunya while travelling abroad. Simple steps such as using insect repellent, covering exposed skin, and sleeping under insecticide-treated bed nets. It's like speaking double Dutch in this. Can effectively reduce the risk. Before you travel, check the Trail Health Pro website for the latest health advice on your destination. A chikungunya vaccine may also be considered for those travelling to higher risk regions. How is chikungunya tested for? According to the World Health Organization, chikungunya virus may be detected directly in blood samples collected during the first week of illness. Other tests can detect a person's immune response to the virus. These are typically used after the first week of infection to test for antibodies to the virus. The antibody levels are typically detectable by the first week after illness onset and can be detected for about 2 months. In order to curb the spread, infected persons should quarantine in the first week of illness. What are the symptoms? According to WHO, the symptoms of chikungunya are simpler to those caused by the Zika virus and include fever, severe joint pain, joint swelling, muscle pain, headaches, nausea, fatigue, and a rash. Severe symptoms and deaths caused by chikungunya are rare and mostly affect young babies, elderly people, and those with underlying health issues. Does that ring a bell? Is there a treatment for chikungunya? There are currently 2 vaccines for chikungunya per the WHO. However, they are not widely available. For pain relief and to help manage symptoms of fever, it is recommended the infected people take paracetamol or acetaminophen. And that's all. So if you want to read up on it and keep abreast of the situation, the spelling of chikungunya is CHIKUN for November, G for golf, U for umbrella, N for November, Y for Yankee, and A for Alpha. That's chikungunya. Anyway, difficult to say. And I hope it's just as difficult to spread. So I hope you found that article useful. I thought, is this one of these things that are going to get out of hand? Are we going to be told it's like the Zika virus eventually? I do hope not. But there are some similarities. Started off in China, then all of a sudden spreads to the UK. The next thing you know, pandemic, lockdowns. So we don't want none of that. So just keep abreast of your situation, and even if you are not in one of these countries, I suggest, and I'm going to buy some because I'm itching already, get some insect repellent and just make sure you look after yourself. And if you are going abroad, make sure that when you do, spray your suitcase and everything you're bringing back with something that kills them, so you don't bring them back in the country unknowingly. And that's all I've got to say for now. Have a wonderful day. I'm going to start my day at work. And yes, stay blessed. Bye-bye.